So if the self-assisted cough techniques don't work or aren't appropriate and the person has someone at home to help them, these are great techniques to try to help the patient move some mucus. So there's 4 cough techniques that we're going to talk about, and I also have a Mary Massery DVD for you to look at on the course files that'll give you some other examples of how these work. But the first one we're going to do is called the costophrenic assist. So you can put your hands down at your sides. What you want to do for this is you want to find the bottom angle of the ribs. The V of your hand should match the V of the ribs at the bottom of the chest. And you're going to put your hands over the ribs on either side so that you can pull down on the rib cage as the patient breathes in. So I'm pulling down in this motion. And the reason I'm doing that is I'm quick stretching the intercostals, the muscles between the ribs, to try and help the patient take a deeper breath in. So we're just going to go through that part of this cough technique first. So you're going to breathe in and then all the way out. Okay, now breathe in, hold it, turn your head, and cough. Yeah, it makes you cough, it works, right? So I kind of went through the whole thing, but the first phase is just getting that deeper breath in. So we'll do that again. Breathe all the way out. Okay, breathe into my hands, in, hold it, and then you would have the patient cough. So when the patient coughs, you're forcefully bringing your hands down right when you're saying cough to promote air behind the cough. So again, you've got your hands on the ribs, you're coming down, you're bringing your hands down and together in a V motion. So you're bringing your hands together, but while keeping them on the bottom of the ribs until the patient breathes all the way in. And then you're having them hold their breath. And then as you say cough, you're bringing your hands together one more time. All right, so we're gonna do it one more time, okay? Okay, breathe out. Breathe in, hold it, turn your head, and cough. Look at that, it's already a better cough. It's already a stronger cough. I'm gonna do what's called the anterior chest compression technique, okay? So this patient has a larger chest wall than our last patient. It's gonna be harder for me to get my hands around his ribs and be able to pull down in a way that's gonna create a quick stretch response to get him to breathe in. So we're gonna do a technique where we're gonna put one of our forearms on the upper chest above the nipple line and one of our forearms under the chest above the xiphoid process. And we're gonna use our body weight. So I'm leaning over the patient and I'm putting pressure through my arms, and I'm gonna have him breathe all the way out. And as he breathes in, I'm gonna facilitate the breath in with the same motion we used with our hands on the ribs, but now I'm using my forearms on the upper chest. All right, so I'm gonna have you breathe all the way out. Okay, breathe in, hold it. And then I'm going to put motion through my bottom arm to help get air out behind the cough. All right, so this time I'm gonna take you through the cough, okay? So when you cough, just cough that direction.
All right.
Okay. All right. When you're ready, breathe all the way out. Okay, breathe in, hold it, and cough. Good, how'd it feel?
Felt natural.
Didn't hurt?
No.
Good. So could you feel how the quick stretch kind of helped you take a breath in?
Yeah.
See, that's great. That's the whole point. So good. The next one we're going to do before we switch back is the Heimlich technique. You would not do this technique on someone who can feel because it's painful and uncomfortable. You also wouldn't do this right after somebody ate because you could regurgitate food because it's very similar to the Heimlich technique that you would use if someone was choking. The key to this one is to find the place on the anterior chest wall where the ribs come together in the xiphoid process. You're gonna go just distal to the xiphoid process. You're gonna place the heel of your hand. You're gonna cue the patient to breathe all the way in and hold it. And then as you push in, you're gonna say cough. So it's gonna be cough, right? I'm not gonna do that here because I don't wanna hurt I actually had a student once who was so stunned he sat up and we headbutted. So I don't recommend doing this on your classmates, but the biggest thing with this technique is the timing, where you say cough and you move your hand at the same time. Great. All right, so first thing we want to do is put the patient in side lying in a hook lying position, which means knees bent, right? You can have the patient hug a pillow if you want. We're going to use 2 hand placements for this. One is going to be on the pelvis. I have my fingers hooked around her ASIS, and then my other hand is going to be behind her shoulder to start. As she breathes in, I'm going to pull back on the pelvis towards myself and push forward on the shoulder. All right, so I'm going to say, breathe in, and hold. And then I'm going to switch my hand placement. I'm going to bring my hand on to the anterior part of her shoulder, my other hand behind her pelvis, and I'm going to wring her out like a towel, and I'm going to say cough. Okay, so we're going to stretch, hold it, and cough. So again, we're using a PNF counter rotation technique for this. There are people who just don't dissociate well, upper body on lower body. There's no one right cough for any condition. There are contraindications to certain coughing techniques. Like you wouldn't want to do an anterior chest compression over a sternotomy, for example. But most of those are common sense. If the family member and the patient find the cough to be effective, that's the one you want to go with as long as it's safe and not contraindicated. So those are the 4 manually assisted cough techniques.